But nonetheless, here's what the Republicans are proposing now. So this is a bill or a proposal that was designed by Senators Bill Cassidy and Mike Crapo. I'll be nice and not pronounce it the other way. Here's how the plan will work. The subsidies for the Affordable Care Act are not part of the equation at all in the Republican proposal. However, the money that was once being used for the subsidies would instead be placed into so-called health savings accounts. Those accounts would only be available for bronze level or catastrophic ACA plans. So under the plan, individuals earning less than 700% of the federal poverty level would receive, $1,000 in HSA funding for those between age 18 and 49, and $1,500 for those ages 50 to 64. The senators say it would lower 2027 premiums by 11%. I am not buying that. Republicans are also stating that extending the tax credits would risk inflating insurance premiums when it's actually the opposite. I mean, the whole point of extending the ACA subsidies or the tax credits was to lower the premiums. And I mean, you're about to see it happen right now. A lot of you have already seen it happen right now. Since the tax credits have not been extended, people are already seeing their premiums double. So how are Republicans going to make that argument? And by the way, let me also say this. It's also an issue that the Affordable Care Act is so flawed that we need to keep extending government tax credits for it to be affordable. So I don't necessarily fully disagree with the Republican Party, but I do disagree with them when they claim that they have better solutions, because they don't, and it doesn't really seem like they care much.
Breaking news. The FAFO is back, baby. There's just so many things to talk about. So I spun the wheel and it landed on healthcare. On my community wall, I put a poll the other day, right? Just to see what people are gonna say. I want to explain to you the reason why I put the poll out there like that. Because as me wandering around the YouTube streets, I've been hearing a mixed bag of a whole lot of different people weighing in about healthcare and things that are going on in this country. So those are how the questions were formed. The statement remains the same, though. Republicans in the Senate has declined the extension of the health care subsidies. Health care cost premiums will allegedly double as of January 1st, 2026. And millions will have no health care insurance coverage under the Affordable Health Care Plan, or ACA, or Obamacare, which people don't like to identify it as, with no replacement plan to be put in its place instead. Only ideals of a replacement plan. So I put out their thoughts respectfully. Option A, will this impact you? Option B, I'm glad it's finally been repealed after 13 times. And option C, I don't care either way. Like I said, the reason why those options were put up there like that was based upon what I've been hearing up in my cloud car as I'm riding through and listening to different panels and people's reactions. That's why. Let's give you a little background. If the ACA, the Affordable Care Act, had not passed when Obama put it in place, we didn't say it was a perfect plan, but it was a plan. The impacts would have been broad, long-lasting, especially for low-income people, Black, brown communities, women, seniors, and anyone with ongoing health needs. Pre-existing conditions would still lock people out. Before the ACA, insurers could deny coverage entirely, charge higher premiums, and exclude treatment for specific conditions. I don't know if you remember that prior to the Obamacare. This included asthma, diabetes, high blood pressure, cancer history, pregnancy, mental health conditions, and a lot more. Without the ACA, millions would still be uninsurable by design, not by choice. If the ACA was not put in place, tens of millions more would be uninsured. The ACA reduced the uninsured rate dramatically. Without it, Medicaid expansion would have never happened. There would be no subsidized marketplace plans, no income-based premium assistance. That means that working people without employer insurance, retail workers, caregivers, people who do gigs on the side, self-employed people would largely be uncovered. Without the ACA, Medicaid would remain far from limited. Medicaid expansion brought coverage to adults who were too poor to afford private insurance, but previously not poor enough to qualify. Without the ACA, many states would exclude childless adults entirely. Preventative care access would be worse. Emergency rooms would remain the default doctor for millions of people. Young adults would be cut off at the age of 18 or 21. The ACA allowed people to stay on their parents' insurance until the age of 26. Without it, college students and early career workers would lose coverage. Young adults will delay care or skip it altogether. Medical debt would hit people before they even get started in life. Preventative care would cost extra or be skipped. The ACA required many preventative services to be covered without copays, including cancer screenings, birth control, annual checkups, vaccines. Without it, people would keep delaying care until problems became emergencies. More suffering, higher long-term costs, worse outcomes. Women would pay more, period. Before the ACA, being a woman was considered a risk factor. Pregnancy was treated as a pre-existing condition. Maternity care was often excluded. Without the ACA, gender rating would still drive up costs. Reproductive and maternal health outcomes would be worse. Postpartum care access would be thinner than it already is. Mental health and substance use care would stay marginal. The ACA required mental health and substance use treatment to be treated like physical health care. And without it, therapy and treatment would remain as optional add-ons. Many plans would exclude them entirely. Crisis-driven care would dominate instead of early support. Medical debt would be even worse. Before the ACA, lifetime coverage caps were common. Annual caps were common. One serious illness could bankrupt a family. Without the ACA, medical debt would be even more widespread. Chronic illness would equal financial collapse for more people. Hospitals would shift more cost onto the patients and the communities. The bottom line is if the ACA had not passed, healthcare would still function as a gatekeeping system, not for public good. Coverage would be more fragile, expensive, and exclusionary. Inequities tied to race, income, gender, and geography would be deeper. The ACA didn't fix healthcare, but it closed some of the most brutal doors that used to be wide open. FAFO, breaking news. There's just so many to talk about. Today, we spun the wheel and it's on healthcare. I'll be right back.
Federal government does not provide health insurance or subsidies to people who are illegally, period. Erica, you pointed this out last week, how $35 billion of revenue is coming out. $7 billion of
uncompensated, yes.
Uncompensated, thank you. Uncompensated costs will have to be paid.
Like, where do you think the $7.7 billion is coming from?
It doesn't just poof into thin fucking air. Okay, the federal government doesn't want to pay for it. And so what the Democrats are trying to say is nobody who's making $75,000 can go from paying $300 a month to paying $900 a month for their fucking health care premiums. So what the Democrats are saying is so that people don't lose their health insurance. And so that we don't take revenue out of the healthcare system, and so that we don't have people forced to get healthcare from emergency services that then become uncompensated care. Let's make sure that the federal government is providing these subsidies. And for the motherfucking record, you will not get a rebate. You will not get any money taken off of your taxes if these subsidies do not go through. You will get zero benefits from these subsidies not being extended. For anybody who's saying, well, I ain't getting no subsidies, so I don't care about. No, you are getting subsidized because that revenue is less revenue that they have to make up from your insurance premiums, from your deductibles, from your copays. So you are getting subsidized.
To message back against that, they're using one word that is very much so the Fox generated, the Rush Limbaugh language, illegal.
Yeah.
What are you talking about?
Yeah.
So if that word, if there is a word that can block a person, their community from being healthy, and community means if your community, everybody look just like you, white, black, or whatever your ethnicity. So you're meaning to tell me what is keeping from that community that you say and love and just say that you voted for Trump. You mean to tell me a person's gonna block their own health and wellness, their ability to live and thrive? Yeah. Because Fox News told them illegal, and then that becomes the defense mechanism by which, nope, I don't want it, I support it. Are you kidding me right now? So you're literally signing your own death certificate because a person is allowing their brain to be rewired to something being adversarial to them because they stuck in the word illegal.
Yep.
That is depraved.
Yeah. And y'all some simple motherfuckers too. Here's my hot take. I don't give a fuck if they want to give healthcare to flying squirrels. If that means that I don't have to pay $900 a month versus $200, give anybody and everybody fucking healthcare insurance. Y'all gonna cut off your nose to spite your face to punish people who, by the motherfucking way, aren't getting these benefits anyway. They're lying about it. That's some dumbass, goofy ass shit.
Breaking news. I told you it was breaking news. There's just so many to talk about. Republicans in the Senate has declined the extension of the healthcare subsidies. Healthcare cost premiums will allegedly double as of January 1st, 2026. And millions will have no healthcare insurance coverage under the Affordable Healthcare Plan, with no replacement plan to be placed in its stead, only ideals of a replacement plan. I ask for thoughts respectfully. And I'm already ahead of you. Yes, numerically, more other people, we call them the others, are enrolled in the ACA coverage than any other single racial group. I repeat, the others are enrolled in the ACA coverage than any other single racial group. But that fact does not mean that the ACA primarily benefits the others, or does it cancel out its importance for the Black, Latino, Native, and other marginalized communities? Let's break it down. Why is it that the others make up the largest share of the ACA enrollees? It comes down to demographics. The others still make up the largest share of the U.S. population overall. That's to be debated. Any large national program will reflect that unless it's race restricted. ACA enrollment mirrors population size, not need distribution. So yes, the others enrollees is the largest number, but not the highest rate of need or impact, allegedly. Raw numbers do not equal disproportionately the benefit. Where does the ACA hit the hardest? The rates, not the counts. When you look at the uninsured rates before versus after the ACA, the biggest gains were among Black Americans, Latino Americans, Native or Indigenous communities, low-income women, people with chronic illness. Before the ACA, minorities were uninsured at much higher rates. Coverage gaps were structural and long-standing. After the ACA, those gaps shrank more sharply for minorities than the others, especially in states that expanded Medicaid. So while the others may be more numerous in the program, communities of color experience larger proportional improvements. They stated that Medicaid expansion is the real racial equity lever. Here's the key point most people miss. The ACA marketplace plans skew more others. The ACA Medicaid expansion disproportionately benefit Black and Latino adults. Why? Allegedly, Black and Latino workers are more likely to be in low-wage jobs by design, jobs without employer insurance, jobs with unstable hours, allegedly. Medicaid expansion filled the gap that hit these groups the hardest. In expansion states, Black uninsured rates dropped dramatically. Maternal and preventative care access improved. Chronic conditions were diagnosed earlier. In non-expansion states, mostly in the South, Black communities were left out of purpose. Politically speaking, millions fell into that coverage gap. This is one of the clearest examples of policy plus geography equals racial outcome. Hold that thought. I'll be right back.
Major news right now, the United States Senate has just rejected the healthcare bills put forth by Democrats and Republicans to extend Affordable Care Act subsidies, all but guaranteeing that ACA subsidies will expire at the end of the year. Premiums will go up, millions will go uninsured. Republicans in the House of Representatives and in the United States Senate right now don't have a cohesive plan on how to protect and fix healthcare. And so many are saying that they're just flying blind. And today there was a vote to extend ACA subsidies on the Democratic side, and then a vote on a Republican plan in the Senate side. Both votes failed. Remember back when the government shutdown ended, that we got a promise of a vote? Democrats got a promise of a vote to extend ACA subsidies? Well, this was the promise of the vote. There is no guarantee, and it's actually looking increasingly unlikely that anything will be done on healthcare subsidies between now and the end of the year. As a result, looks like ACA premiums are about to skyrocket. Spread the word, follow along, stay up to date on all the news that you need to know about. I'll have more to come soon.
There's going to be a vote tomorrow on the extension of the Obamacare subsidies. And although this is not a left-right thing or a Republican-Democrat thing as it pertains to the impact, Republicans in the Senate, and I do believe in the House also, are going to vote against extending these subsidies. They don't want to extend them. They had a meeting today, and there were no Republicans in the meeting. And there's women or people from all around the country talking about the benefit of these healthcare subsidies and how their life is going to be impacted and their finances are going to be impacted should they go away. And it was pretty compelling. And I know a lot of y'all are saying, well, you know, I don't have Obamacare, so this doesn't affect me. Well, it doesn't affect you today. I can say that one of the people said that this time last year compared to this time last year, twice as many people have already canceled their policies. They're not going to renew their Obamacare in 2026. A lot of people that have Obamacare are waiting to see what goes on with this vote before they decide whether they're going to cancel their shit or not. I don't know about your budget, but if I'm paying $500 a month for health care this year, I don't have a whole lot of room in my budget to pay $1,500 for the same fucking service. So that I can see how that's going to be a problem for a lot of Americans. And so you're thinking like, yeah, this doesn't have anything to do with you. Well, it kind of does, because like I said previously, insurance companies are going to get their money. So if you have insurance through your work, and all these folks cancel their Obamacare, the insurance company is going to look to recoup that money. They're never going to just sit around and take a L. They're not going to do it. Where else can I make this money up? Okay, well, we're not charging y'all enough because we have so many people that are no longer in the marketplace. So when they go to your company, your employer, and say, dude, like, seriously, you know, we're going to have to raise your prices. Your company's not going to eat that. They will likely pass it on to you. If you're lucky, they'll split it with you and shop it the next year. But they're going to, yeah, they're going to pass that shit down. And for the people to say, well, you know, no, I have a job, da 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 da. The way they're laying off people now, I would not get too comfortable with that either. You have a job today, like you're unaffected today. Tomorrow could be completely different. A layoff changes everything. So that's something to keep in mind. And again, unless you are a billionaire, you will be affected. unless you just got perfect health and no worries, and you have health care, even if you got an accident, you covered because you got something left, like you have money waiting for you. Good for you. I'd say about 99% of us don't. So it's just something to keep in mind. You're not that far removed from the problem as you think you are.
I'm steady talking to y'all. Listen, the minions have risen in the house. That's why there's so much noise level going on. All right, the minions have arisen. But I'm going to try to get through this. Like I told you before, breaking news. The Republicans in the Senate has declined the extension of the health care subsidy. Rates will allegedly rise January 1st of 2026, and millions will have no health care insurance under the ACA. Pre-existing conditions is an unequal burden but equal protection, because pre-existing conditions protections apply to everybody, but the burden wasn't equal. Black and Latino communities have higher rates of hypertension, diabetes, asthma, autoimmune conditions, pregnancy-related complications before the ACA. These conditions were denied higher costs, exclusions that translated into systemic lockout from coverage. The ACA didn't target race, but it removed a tool that disproportionately harmed minorities, women of color, and maternal health. This is critical. Before the ACA, pregnancy equal pre-existing conditions. Maternity coverage often was excluded. Postpartum care inconsistent or absent. After the ACA requirements, maternity care became essential coverage. Preventive services expanded, and Medicaid expansion helped stabilize coverage around childbirth. The results were that white women also benefited, but Black women who faced far higher maternal mortality benefited more in impact. Even still, disparities remain because coverage alone doesn't erase bias. But without the ACA, the situation would be far worse. Let's talk about that mental health and substance abuse. Mental health parity under the ACA mattered across races, but the other Americans historically accessed mental health care at higher rates. Communities of color face stigma, cost barriers, and provider shortages. The ACA itself made coverage mandatory, didn't fix access or trust issues, but removed cost as the first barrier. Again, equal policy, unequal starting line. I'll be right back.
States are now starting to release the actual numbers on what the Republicans' policy changes have done to health insurance costs with this legislation that they've passed this year. This is what the Democrats have been making a stink about. You've heard, like, Democrats are concerned in the shutdown fight about health care costs and health insurance, and you think, like, oh, Democrats are always concerned about health costs. That's nice. I care about health costs. I'm glad they're standing up for it. No, it's this specific thing. You want to know what the Democrats are making a stink about with the shutdown? You want to know what the Democratic side is of the fight over the shutdown? Look at these numbers from the New York Times tonight. Look at this. This is for the tens of millions of Americans who get their health insurance through the online marketplaces. Look. Based on the newly posted information, meaning the pricing information that's now being posted in multiple states, a family of four making $130,000 in Maine, so you combine the family's income, everybody's salaries, you got up to $130,000, that family would face an increase in their annual health insurance premiums next year of $16,100. That's how much their health insurance premiums would go up. But maybe that's, that sounds like it's a fairly well-off family, and you think, oh, well, maybe that doesn't apply to me. I'm not quite in that kind of a bracket. Well, imagine you're in a couple, you're each 60 years old, and you put both of your salaries together, combined, you make $85,000 a year. So maybe one of you's making 40 grand a year, maybe one of you's making $45,000 a year. Combined, your couple's income is $85,000 a year. In Maryland, your insurance premium is going to go up by $13,700. In Minnesota, your insurance is going to go up by $15,500. In Nevada, it's going to go up by $18,100. In Kentucky, the increase for you guys as a couple will be that you are expected to pay an additional $23,700 per year. That is the amount of increase we are looking at in people's health insurance premiums. Can your family afford just randomly an additional charge of $24,000 for exactly what you're getting right now, for $24,000 less than that? I mean, these are insane numbers. But this is what Republicans, in their policy changes on healthcare, what they have done to health insurance costs. And this specifically is what Democrats have been screaming bloody murder about. This is what Democrats have been drawing the line about in this shutdown, telling Republicans that this is the thing they need to fix. Think they're going to fix it? Think they will? President Trump doesn't appear real focused on it.
Young adults and their intergenerational impact. The under 26 rule helped white families, Black families, Latino families, but families with less wealth, less employer coverage, more student debt felt the relief more sharply. And that's often families of color, even if the raw enrollment numbers didn't show that. So what's the real truth? Yes, more other people are enrolled in the ACA coverage by number. Also true. The ACA reduced racial insurance gaps. Medicaid expansion was especially powerful for Black and Latino families and communities. Where states blocked expansion, minorities paid the price. The ACA softened, but did not erase structural inequities. The ACA is race neutral in design, but race impactful in outcome, because it removed barriers that were never evenly distributed to begin with. I want to show you something.
We talked about people at 100% to 400% of the federal poverty level. But what about the near poor in non-expansion states? They fall into what's called the coverage gap, and I'll talk a little bit more about that later. But first, what are the non-expansion states? 9 states, actually 10, but Wisconsin covers its people. To give you a sense of how many people fall in this category, look at this chart. Here's a list of questions to ask to figure out if this may apply to you. Here's why this happens, why the coverage gap exists in these non-expansion states, in case you're curious. Why does the Kill Bill make it worse? Here's why. It's really a horrible situation because people can't move, prices are going up, and if you're below 100% FPL, things are rough for you. The one practical thing you can do is be sure to register to vote in 2026 and vote against Republicans who did this to you.
So you ask me what's next, what to do. Listen, the COC, Collaboration Over Competition, has been telling you for months what's about to happen, what's going on. We just spun the wheel today and it came up healthcare. There's so many different facets of things that are changing so rapidly in our country. Allow me to share something with you. You want to know what's next? Let the COC explain it. They thought changing the language would change the outcome. Thought if they scrubbed the blood off the timelines, we'd forget who bled. They tried to sever the roots that connect us to divine brilliance, thinking that if they snapped the stem, the branches would wither. But our roots are ancestral. They don't just run deep, they run wide, across oceans, across centuries, across whispered names and spiritual codes that survive even the most violent storms. This isn't sentiment. This is survival. This isn't nostalgia. This is strategy. Because to remember is to resist. To remember is to rebuild. To remember is to reclaim everything they swore we never know and never be. May our memory be sharper than their lies. May our stories outlive their systems. May our spirits outshine every attempt to extinguish us. We are just getting started. Let's move.
Welcome to Conversations That Protect. Let's move, and this time we move ready.
Welcome to your journey home. That's example number one. Don't take the bait.
This is not survival, this is return. You feel that? Yeah. We already home. Welcome to Conversations That Protect. Welcome to the blueprint. Welcome to the war room. Welcome to the rebirth. Welcome to the moment you finally said yes for real. Welcome to your journey home. We don't speak to perform, we speak to prepare. We don't hand out hope, we hand down prayers. Every word's a bomb, a blade, a blanket. This is soul armor in songs. Coming close, baby. We got you. That ache you carry, it's just your ancestors waking up in your chest. This is the welcome home. Long overdue. Breathe in the ashes, that's where you begin. The girl you were, she blessed the fire. The woman you becoming, she walks through it in gold. This is your shedding, this is your stretch, this is your return. You whispered yes, and the universe cracked wide open. No more maybe, no more delay. You said yes for real. Now spirit can move through you.
We've been giving you the blueprint all along. Financial empowerment. How to situate yourself going back home. It's because you got to go back to basics. I'm not done yet.
This is not not survival. This is return. You feel that? Yeah. We already home. Welcome to conversations that protect. Welcome to the blueprint. Welcome to the war room. Welcome to the rebirth. Welcome to the moment you finally say yes for real. Welcome to your journey home. We don't speak to perform, we speak to prepare. We don't hand out hope, we hand down prayers. Every word's a bomb, a blade, a blanket. This is soul armor in songs. Coming close, baby. We got you. That ache you carry, it's just your ancestors waking up in your chest. This is the welcome home. Long overdue. Breathe in the ashes, that's where you begin. This is your shedding, this is your stretch, this is your return. You whispered yes, and the universe cracked wide open. No more maybe, no more delay. You said yes for real. Now spirit can move through you unapologetically. Say it with your chest. Welcome to conversations.
While we were all scrolling around through the sites, the COC's been putting that work in, trying to tell you what's about to happen and how you can do to protect yourself. Big Brother Mouthpiece was over there taking us to school on sovereignty, protecting ourselves, knowing our rights, what to do when it's time to go, and how you prepare for that. You want to know what's next. We've been putting that work in, trying to help our people, help the community, how to help the community at large. It ain't about color. Damn. It's about how to get through, remembering where we came from. Sometimes you got to go back to basics and put that back into effect in order for us to survive this long winter that we're about to go through. And I don't mean the season. I'm talking about the winter of the next 3 years.
Welcome to conversations that protect. Welcome to the blueprint. Welcome to the war room. Welcome to the rebirth. Welcome to the moment you finally said yes for real. Welcome to your journey home. We don't speak to perform, we speak to prepare. We don't hand out hope, we hand down prayers. Every word's a bomb, a blade, a blanket. This is soul armor in songs. Coming close, baby. We got you. That ache you carry, it's just your ancestors waking up in your chest. This is the welcome home. Long overdue. Breathe in the ashes, that's where you begin. The girl you were, she blessed the fire. The woman you becoming, she walks through it in gold. This is your shedding, this is your stretch, this is your return.
We have since ended the series, but each one of us in the COC took a part in it. I don't have to keep beating a dead horse. Go back to each one of these content creators. You got Goddessy of Love. You got Holistic Royalty by Kells. You got Seval, Madam Oracle. You got Alicia Dion. You have Big Brother Mouthpiece. And yours truly. Go back and look at each part of the COC's presentation of the journey home. You want to know what's next? Go handle that and see if there's something that you can pick up in order for you to get you through this season. Because this is just the beginning, baby. It's already having a trickle-down effect. FAFO. FAFO. We here now. All right? Be well, stay safe, and thank you for tuning in to this episode of FAFO. I might come back with some other things if I spin the wheel and see what pops up next. You know what I mean? All right. Be well. Have a good one. Talk to y'all soon.
Fixated with the pain, prayers with the grind. Trauma in my DNA, but I still realign. Roots in the dirt, spirit in the ceiling. This ain't just therapy, this that blended healing. Concrete rose, yeah, I bloom through the feeling. Tapped into truth in these healing realms. Stitching my soul in the blended healing realms. Bless up. From the stoop to the shrine, I've been earning my life. Didn't pray for a savior, had to learn how to fight. Burning sage like incense, but my spirit don't fold. Still got pain in my pocket and this mic I hold. I ain't soft, I'm sacred, that's strength in disguise. Eye to eye with my demons, I ain't blinking this time. Broke every curse that was signed in my blood. Now I dance in the storm, make a waltz out the mud. Meditating in chaos, peace in the noise. Built a temple from trauma, turn my cries into voice. Crystals in my hoodie, cards in my palm. Yeah, I tear it through the trenches and I'm psalm through the psalms. Word.
Whispers in the wind say keep going. My past ain't changed, it's gold, I'm growing. Every wound is a prayer in disguise. I bleed truth and I rise.
I mixade with the pain, prayers with the grind. Still trauma in my DNA, but I still realign. Every roots in the dirt, spirit in the ceiling. This ain't just therapy, this that blended healing. Concrete rose, yeah, I bloom through the feeling. Tapped in the truth in these healing realms. Stitching my soul in the blended healing realms. Blended healing realms. Fire in the rhythm, heat in the sound.
Fire.
COC energy shaking the ground.
Yeah, it's big COC energy.
No chains can hold us. We rise, we fight.
Let's go.
Voices in the darkness, we bring the
Now
light.
let's take them higher. Yeah.
Fire in the rhythm, heat in the sound.
Fire.
COC energy shaking the ground.
Yeah, it's big COC energy,
No
family.
chains can hold us. We rise, we fight.
Let's go.
Voices in the darkness,
Listen.
we bring the light.
They try to write us off like a bad check. They try to overshadow our divinity on the neck. But so much disrespect. Knowing they mama chiefs then taught them we better than that. Stop being foolish in your pride. Say where your conscience at. Just cause we carry the fire don't mean we won't be where the party yet. Enough of that mental and spiritual change. It's time to get your power back. You tired of living in the dark, then come on where the light is at. It's COC.
Fire in the rhythm,
Yeah.
heat in the sound.
Yeah. Let's go.
COC energy shaking the ground.
Yeah, it's big COC energy,
No
family.
chains can hold us. We rise, we fight.
Let's go.
Voices in the darkness, we
Yeah.
bring the
Listen.
light.
COC fire, continue to shine bright. It's shining all day and it's shining all night. Let's go. COC fire, continue to shine bright. It's shining all day and it's shining all night. Let's go. COC fire, continue to shine bright. It's shining all day and it's shining all night. Let's go. COC fire, continue to shine bright. It's shining all day and it's shining all night. Let's go.